It's all well and good and important to be able to analyse differences in health status between Australia and developing countries when you are given the data. This is what we looked at in the previous video. But something else that is important is being able to discuss why those differences may exist in the first place. And that is what this video is all about. It's almost like trying to explain Australian football to somebody new to the game. It's easy to say the Blues won because they scored more points than Melbourne, but if you can't explain why the Blues scored those points in the first place, then your friend will remain confused. Similarly, if you can't explain why differences in health status will occur, the examiners will remain confused and you will likely stay markless. There are 7 factors that VCAR specifies that may account for differences in health status. So these are the ones that you should focus on. The 7 factors are income, gender equality, peace political stability, education, access to healthcare, global marketing, and physical environments. Below this video, you will find a more detailed explanation of each factor, showing how it can influence global health status and account for the differences between Australia and developing countries. But for now, let's go for depth rather than breadth of understanding. Here is a question from the 2013 VCAR exam. You may recognise the table of data because we have used it already in discussing the differences between developed and developing countries. But here, we are focusing on part B of the question, which is worth a large 6 marks. The question reads, discuss 2 factors that could account for the differences in health status between Australia and the developing country selected in Part A. We need to discuss 2 factors, and there are 6 marks in total. Thus, each factor is worth 3 marks. We will walk through one response. Then, you can have a go at completing the other factor yourself. We can use any of the 7 factors, so long as we can justify them. For sake of simplicity, I'm going to use the first one listed, income. Income is also directly relevant to the provided table because gross national income is listed. So to get the 3 marks, we will probably need to identify a relevant factor, incorporate some statistics from the table, and directly relate that to the impact on health status compared to Australia. For example, we could say this. Remember that we chose Chad as our developing country in Part A of the question. One factor that could account for the differences in health status between Australia and Chad is income. Australia's gross national income per capita is considerably superior to that of Chad, which suggests that the average income of those in Australia would be much higher than those in Chad. Here, we have named the factor and underlined it before incorporating data from the table directly into our response. Care has also been taken to specifically mention the 2 countries being compared, Australia and Chad. Next, we need to link income to health status. We could say, those with a higher income would generally have greater access to healthcare services, nutritious foods, and recreational activities. For example, a greater income may mean that an individual is more inclined to pay the money to see a doctor. More frequent use of healthcare facilities is likely to lead to better diagnosis, treatment, cure, screening, and prevention of diseases and illnesses. Thus, life expectancy would be improved and burden of disease lowered. As life expectancy and burden of disease are both health status indicators, it appears apparent that income is one factor that could account for the differences in health status between Australia and Chad. Now it's your turn. Following this template, try to explain the impact of one of the remaining 6 factors on differences in health status. Bye for now and happy studying.